Imagine, for a moment, a healthcare system that doesn't just react when you get sick, but one that actually anticipates illness, maybe prevents it altogether. Where treatments are designed, specifically for your biology, your lifestyle, and where really good care is available to everyone, everywhere. Sounds futuristic, right? Well, it's happening faster than you might think. Welcome to the Deep Dive. Today, we're getting into the future of healthcare. And we're drawing heavily on the work of George Bickerstaff. If you don't know the name, he's a major figure in global business and health, former CFO of Novartis Pharma AG, a big public health advocate. So he brings this wealth of experience. We'll be exploring how technology, changing populations, and what we expect as patients are just fundamentally reshaping medicine. It's really moving beyond just fixing things when they break. It's about a smarter, more connected, and I think a truly human-centered way forward.
And it's critical to grasp that these changes, they aren't really optional, are they? The source material makes it really clear. Costs are soaring, populations are aging, we face global health threats. It all demands this kind of new thinking. So this deep dive, it's about uncovering these proactive, precise, and inclusive solutions that could, not just help us live longer, but genuinely improve how we live.
Yeah, and just to frame this whole conversation, there's that old quote from Voltaire, something like, "The art of medicine consists of amusing the patient while nature cures the disease." Oh. That makes you wonder, doesn't it? In this new era of tech and personalization, how much of that still rings true? Or are we finally getting past just amusing people and really empowering their own health? Okay, let's get into it. Right, let's start with maybe the biggest game changer. Personalized medicine. Healthcare is really ditching that old one-size-fits-all approach. We're talking about treatments designed literally for you, your biology, your habits, your data.
It's a massive leap. And it's possible because of a few key things coming together. Genomics, for instance. The source really highlights this. So instead of just standard prescriptions, we're looking at pharmacogenomics, which means your genes can tell doctors how you'll likely react to a specific drug. Finding the right dose, the right medication, minimizing side effects, it's huge. And it's also about spotting predispositions, genetic risks for things like cancer or heart disease way earlier, allowing for screening, lifestyle changes years before you might even feel anything. Think about it, maybe a blood test telling you your unique risk profile, how to live your healthiest life.
So it's moving from just treatment to really precise prevention. How do things like wearables fit in? My watch, for example.
Oh, they're absolutely central to this. And they're way beyond just step counters now. We're talking continuous glucose monitors for diabetes, real-time heart tracking, sleep analysis. Some can even pick up on things like AFib, irregular heart rhythms. These devices collect this constant stream of biometric data. And when you feed that into AI systems, they can spot tiny changes, anomalies. That might be the very first sign of trouble. So it shifts everything from being reactive, waiting till you're sick, to being predictive, proactive, maybe flagging something long before symptoms appear, alerting your doctor.
Allowing for early intervention. That sounds incredibly powerful. Makes healthcare feel more effective, maybe more humane.
Exactly. More effective, efficient, tailored. But you touched on something important earlier, the practicalities. All this data, privacy, security.
Right. How do we manage all that?
Yeah, that's the million-dollar question. And the source is clear. We need robust, secure systems, interoperable systems. Trust is everything. People need to know their data is safe and used responsibly. It's not just about collecting data, it's analyzing it smartly with AI to get actionable insights.
Yeah.
While using, top-notch encryption and following strict rules, it's about making care truly personalized and humane.
Okay, so we have this highly personalized care. How does it actually get to people? Especially if they're not near a major hospital. Telehealth boomed recently, but you're saying that's just the beginning.
Absolutely, just the tip of the iceberg. What's really changing is what patients expect. We're used to getting everything on demand, right? So why not healthcare? People want to connect with their doctors when and where it works for them. And it's way beyond just video calls now. Think remote patient monitoring. It's becoming standard for chronic conditions, hypertension, heart failure, diabetes. You use devices at home, send vitals straight to your care team. They can step in quickly if needed. And then there are mobile health tools, apps for reminders, tracking symptoms, support groups. They're becoming part of daily health.
So it's really about expanding access then, not just convenience for those who already have it. What about underserved areas?
Exactly. That's a huge part of the potential. This digital shift can be massive for people in rural areas or for anyone who struggles with transport or getting time off work. That specialist visit that used to mean hours of travel, now maybe it happens from your kitchen table. It also takes pressure off clinics for routine stuff, making care possible that was just out of reach before for so many. The source really emphasizes this idea of a blended system, in person when needed, digital when effective. Quality has to match or even beat the old ways.
A blended system makes sense.
Yeah.
But does the quality, the experience really hold up virtually? Can you build that same trust over a screen?
That's a fair question. And it's not about perfectly replicating an office visit. It's about leveraging the tech's different strengths. Like remote monitoring gives you data over weeks, not just one snapshot in the clinic. That's powerful. Virtual visits, sometimes they can actually be less rushed, more focused, and for many people, being in their own home is just less stressful. Sure, complex diagnostics need hands-on, but for primary care, managing chronic stuff, mental health, the data shows satisfaction and outcomes are often just as good, sometimes better because it's easier to stick with it.
Okay, let's talk AI, artificial intelligence. It
Sure.
sounds like sci-fi, but it's actually making decisions in healthcare now.
Yeah.
How much?
Yeah, it's here. And the key thing is, it's not about AI replacing doctors, it's about augmenting them, giving them superpowers almost. AI can analyze massive, massive data sets in ways no human possibly could. Seconds, not days. Think about diagnostics. AI reading x-rays, MRIs, scans, sometimes spotting things, tiny tumors, early heart issues, maybe even more accurately or faster than the human eye. Or drug discovery. AI can simulate how molecules might interact, predict if a drug will work, flag side effects. That speeds up the whole process incredibly. Saves years, saves billions.
That speed and precision is just mind-boggling. What else? How does it help doctors on the ground, day to day?
It's also about making things run smoother. Clinical trials, for example. AI can help find the right patients faster, predict if a trial might succeed, and a really big one, potentially reducing physician burnout by automating some of the tedious stuff, the admin tasks, transcribing notes, sorting records. That frees up doctors, nurses to focus on the complex human side of care,
Yeah.
the empathy, the connection. That's where they're irreplaceable.
Right, empowering them, not replacing them. But the source stresses responsible use, transparency. What does that actually look like for you, the patient? How do we trust these algorithms?
That's absolutely critical. Responsible AI means a few things. One, making sure the AI learns from diverse data so it doesn't bake in biases. Two, making its decisions explainable. Doctors need to know why the AI suggests something, not just take its word for it. It can't be a black box. Transparency means being open about when and how AI is involved in your care. And trust. That comes from testing, from regulation, from constantly checking these tools are safe, reliable, and fair for everyone. It has to be a trusted partner, not some mysterious oracle.
Okay, so we have all this amazing tech, personalized medicine, AI diagnostics, but the source makes a really strong point. None of it matters if it's not fair.
Absolutely fundamental. What's the point of innovation if it deepens the divides we already have? The source is emphatic. Equity can't be an add-on. It has to be designed in from the very start. That means tackling the social determinants of health. The non-medical stuff that hugely impacts how healthy you are. Your income, your education, where you live, access to good food, community support. These often matter more than the actual medical care you receive.
So it's looking way beyond just clinics and hospitals. What practical things can be done to build that equity in?
It means intentionally investing in underserved areas, not just clinics, but broadband for telehealth, community health workers who know the local reality, digital literacy programs. It also means ensuring services are culturally competent, diverse providers, care that respects different backgrounds. The aim is to make sure technology closes gaps, doesn't widen them, no one left behind because of their zip code or circumstances.
It's a huge challenge, though. Isn't there a risk that these expensive, high-tech solutions could actually make things less equal if we're not careful?
The risk is definitely there. If personalized genomics or advanced AI tools are only affordable for the wealthy, yes, the gap could widen. But the source argues strongly that this isn't inevitable. It's why equity must be a core design principle. We need things like tiered pricing, maybe subsidies, public-private partnerships focused specifically on access, strong public health infrastructure. The goal is to leverage these powerful tools to reduce disparities, make advanced care a right, not a privilege. Innovation has to lift everyone.
And it's not just about physical health, is it? There's a big shift towards seeing the whole person.
Yeah.
Mental wellness is finally coming into focus.
Yes, and what's really powerful is the integration. For so long, mental health was over here, physical health over there, siloed, stigmatized. The future is about recognizing they're completely intertwined. So we'll see behavioral health woven right into primary care. Talking about your mood should be as normal as checking your blood pressure. We'll see mental wellness programs becoming standard in workplaces, schools, communities, catching stress, anxiety, depression earlier.
So it's proactive wellness, not just reactive treatment for mental illness. How does that integrated whole person approach actually change things for you?
It means care feels seamless. Imagine talking to your GP about chronic pain, and they immediately connect you with a therapist in the same practice for coping skills, or a nutritionist. It leads to better outcomes across the board. Untreated mental health issues often make physical problems worse, and vice versa. This approach reduces relapses, cuts overall costs, and crucially chips away at that awful stigma around mental health. It's about seeing you, the whole person, not just a collection of symptoms, aiming for sustainable, long-term well-being.
Now let's talk money. For ages, healthcare rewarded doing more stuff, more tests, more procedures, but that seems to be changing.
It is, thankfully. We're seeing this major pivot from fee-for-service, paying for every little thing, to value-based care. The basic idea is paying providers for keeping patients healthy, for good outcomes, not just for the volume of services. This completely changes the incentives. Instead of getting paid more if someone keeps ending up back in the hospital, the system is incentivized to prevent those readmissions, better chronic disease management, more preventative care.
So everyone, patients, doctors, insurers, is aiming for the same thing, better health. How does that actually work? What does it look like?
Well, it encourages things like much better peer coordination, making sure specialists are talking to each other, proactive outreach to manage chronic conditions. You see models like accountable care organizations, or ACOs, groups of doctors and hospitals working together. If they deliver high-quality care, keep patients healthier, and save money compared to benchmarks, they share in those savings. It helps cut down on unnecessary tests and treatments, lowers costs overall, and aligns everyone towards that shared goal, healthier people.
Sounds like a smarter system, focused on keeping people well. How does technology support this shift to value?
Oh, technology is crucial here. You can't measure value without good data. So, robust electronic health records, strong data analytics, predictive modeling, they're all essential. AI can help pinpoint patients who are at high risk and would benefit most from extra support or preventative action. Digital tools help care teams communicate and coordinate better. Tech is really the backbone that lets you measure outcomes, track quality, build trust, and reward what actually matters, keeping people healthy.
Okay, here's a fascinating idea. What if the hospital of the future is actually your own home?
It sounds radical, but it's happening. Advances in telehealth, mobile diagnostics, remote monitoring, they're making home-based care a real viable option for more and more things. Think post-surgery recovery, managing chronic conditions like heart failure, maybe even some types of acute care, all at home. You've got wearable sensors tracking vitals, smart pill dispensers, virtual nurse check-ins. It's becoming quite sophisticated.
That definitely sounds better for the patient experience. Less stress, more comfort. But is it safe? Is it as good as being in the hospital?
That's the key question. And it's not for everyone or every condition, obviously. It's about careful selection. Patients who can be managed safely at home, often with clear protocols and maybe even rapid response teams available. But for those patients, the benefits are huge. Lower stress, less risk of hospital infections, potentially faster healing. And for the system, it frees up hospital beds for the sickest patients. It's more efficient. The source really argues that with the right tech, the right support, home-based care is safe, it's scalable, and it's definitely here to stay.
So all these changes, AI, virtual care, home care, they must require a huge shift in the healthcare workforce too, right? New skills, new roles.
Absolutely. The workforce of tomorrow will look quite different. The source talks about roles like digital health coaches, helping people use health apps effectively. AI interpreters who can bridge the gap between complex data insights and clinical practice. Genomic counselors, helping us understand our genetic risks and options. And existing roles. Doctors, nurses, therapists, they'll need ongoing training. Digital skills, data literacy, working in teams in new ways. Flexibility is key. It's about humans and technology working together, augmenting each other.
A massive retraining effort needed then. And what about burnout? That's already such a huge issue. How does this future address that?
It's critical, and the source says perks aren't enough. It needs real system redesign. Thoughtful use of technology can help here, automating those burdensome admin tasks we talked about, freeing up time for actual patient care, which is why most people went into healthcare. It also means fostering more flexible work arrangements, supporting mental health for providers, and building truly collaborative teams where the load is shared.
And finally, none of this can happen in a bubble, can it? It requires everyone working together.
Exactly. This isn't something one company or one hospital system can do alone. It demands collaboration. Tech companies working with health systems, educators updating training, policymakers creating smart regulations, communities getting involved. Big challenges like health equity or the next pandemic require breaking down those old silos, sharing knowledge, sharing responsibility. That collective effort is what will drive real, lasting, inclusive change.
Okay, wow. We have covered so much ground in this deep dive, from healthcare tailored to your genes, AI helping doctors, the absolute need for fairness and equity, seeing the whole person, including mental health, right through to your own home becoming a place for healing. So bringing it all together, what does this mean for you listening right now?
Well, connecting all those pieces, the big picture is pretty clear. Healthcare's future is definitely personalized, it's predictive, it's much more patient-focused. Digital tools are making care more accessible, improving outcomes in ways we couldn't have imagined just a short while ago. But, and this is the crucial but, all this progress hinges on those core foundations: equity, trust, transparency, and genuine collaboration. They aren't optional extras. They're essential to make sure this future serves everyone and
Yeah.
stays human.
Yeah, and the source gives some clear do's and don'ts, too. Remember, technology is a tool, not a replacement for empathy, for that human connection. Don't let it become that. And we absolutely cannot ignore disparities. Tech alone won't fix unfairness. We have to actively design for equity. Instead, the advice is to champion those partnerships, break down walls, work together, and always treat mental health as vital.
Which leaves us with a really important question for you to think about. As technology keeps pushing boundaries, keeps doing more amazing things in healthcare, how do we make absolutely sure that the human side, compassion, connection, trust, remains right at the heart of it all? How can you push for a system that truly sees the whole person, not just data points, in this incredible transformation?
Something to definitely ponder. Thank you so much for joining us on this deep dive into the future of healthcare. There's clearly so much more to discuss and watch unfold. We hope this sparked your curiosity for what lies ahead. Until next time.